Hey guys, Jimmy again. So in the previous video, we talked about the first part of the trauma assessment. Now we're going to go ahead and go into our second part of the trauma assessment, which is the head-to-toe assessment. Okay, so with the head-to-toe assessment, what I like to do is I like to think of myself as like a scanner. Right? So basically, I'm going to start with the head, and I'm going to move my way inferior or down from the patient and check those organ system or maybe the features in that area, making sure I'm not missing anything. Okay, so starting off with the head, or before we start off with the head, when I look at my patient, yes, I see this right here, but I also try to visualize the patient in this area, like this. I know it's a little weird, but this is gonna help me basically not miss any organs or any injury that the patient may have. Okay, so starting off with the head, I'm gonna go ahead and check for or palpate the scalp area as well as the posterior side as well. Checking this area. Again, I'm not lifting up the patient's head. I'm just with my glove hand. I'm just feeling back there, making sure there's no blood or anything like that. Right, and then the next area would be down here, which is the eyes and the ears. Right, the eyes are what I'm looking for, or if the eyes are pearl, and as well as any what we call raccoon eyes or double black eye. And this, if the patient do have this is gonna tell me a couple things, right? If the patient has any head trauma, right? Maybe like a baseball bat to the head or anything like that. All right, and then the next thing we're gonna look at are the ears, on both side or bilaterally. Okay, what we're looking for is if there's any CSF or blood that's coming out of the ear, as well as what we call battle signs. Again, this is a sign of a head trauma, head injury. Right, the next thing we're going to do is palpate around the orbit. So I want to move to this view here. So what I'm looking for is I'm palpating around the orbit or the zygomatic process and making sure there's no abnormalities, right? As well as the mandible, making sure everything is intact. And the next thing I'm going to check is again the nasal bone as well. Right, palpate that, and I'm going to look at the patient's nose. Okay, Teresa, I'll see you around 8:10. All right, so I'm going to check for the patient's nasal septum, making sure that's not deviated, as well as anything that's coming out of the nostrils. Could be CSF, blood, or secretion. And that's what I'm looking for in the nose area, as well as the mouth, making sure there's no missing teeth or patient's not choking, there's no blood in the mouth, things like that. Okay, so that's for the head. Next thing I'm going to do is I'm going to go ahead and move down to the neck area. All right, so the neck area, what I'm looking for is JVD. Let me bring up the patient's veins. Right, this is the JVD right here, making sure we don't have JVD, which is a jugular vein distension, right? If it's not bulging out, and the tracheal deviation, which is right here. It should be straight like this, right? If it's like to the side, right? Again, that's a sign that something else is happening. Okay. All right, that's the neck area. We're also checking for, let me spin this patient around. We're going to palpate around the cervical spine as well, this area, making sure there's no step off, there's no blood. Okay, now we can go ahead and move down to the chest area. When I get to the chest area, I immediately do a barrel hoop on the chest. And what I'm doing is I'm using both of my hands. I'm grabbing onto the side right here, and I'm basically squeezing in, lifting up, and gently pushing down, feeling for any abnormalities. If there's any of these, any rib fractures or anything like that, you'll definitely be able to feel it. And then next thing I'm going to do is I'm going to go ahead and use my karate chop hands and palpate down this mediastinum right here, this bone right here, making sure that's all intact. And then I'm gonna go ahead and auscultate the lungs. Again, what we're doing is we're auscultating the apex, base, base area in that order. Okay, so why we do that is we want to compare both sides, both apex and both base, as well as doing the mid-axillary area as well, bilaterally, both sides. Okay, so that's the chest area. Then we're going to go ahead and go into our abdominal area. Okay, so for the abdominal area, what we're doing is we're splitting the abdominal into the 4 quadrant. Okay, so this is going to be the upper right, upper left, lower right, and lower left. Okay, so I'm going to go ahead and palpate that for the 4 quadrant, checking for, again, decap BTLS, as well as maybe anything that's abnormal. Could be, you know, a pulsating mass, which could be an indication of like a ruptured aorta or something like that. All right, and we're going to go ahead and see here. We're going to go ahead and do the barrel hoop for the pelvic girdle as well. And then we're going to go ahead and check the genitals, making sure if you're testing, you're going to verbalize that you're going to check or assess the genitalia area for any incontinence or priapism or anything like that. And then next thing you're going to do is you're going to go ahead and, let me move this down. We're going to go ahead and check for the lower extremities, palpating her down the leg, right? Making sure, again, there's no decap BTLS. We're going to go ahead and do a PMS or CMS. And then I would go back up this leg, just so I'm covering everything. Then I'm going to do it the same for the upper extremity. Checking for decap BTLS and checking for, again, PMS or CMS. Same thing on this side. Okay, then I'm going to go ahead and let me clear this area, and I'm going to check the posterior side. Okay, so posterior side, I'm going to go ahead and with the partner, I'm going to flip the patient around. I'm going to go ahead and check the rest of the spine, palpating, making sure that there's no step off or anything like that, any incontinence that the patient may have, as well as, yeah, that's basically it. And then I'll actually palpate or auscultate the back as well, apex, base, base, just to make sure that we have bilateral lung sounds. And that's basically it. Move this patient back. Let's give her back her skin. Okay. So, yeah. So that's basically it. And then after that, we'll go ahead and manage any secondary injuries or wounds as appropriate. And then if this is a critical patient, we'll reassess every 5 minutes. And then, you know, basically look at what your interventions are, if it's still holding and stuff like that. And that should be it for your head to toe assessment.